Good afternoon, everybody. Welcome to my channel eduhub.2m. I'm Dr. Jyotishan, and now I am going to discuss about exercise and exercise stress testing. So, exercise is a fundamental to human health, while exercise stress testing serves as a crucial diagnostic tool in modern cardiology. So this exercise stress testing actually it is a diagnostic tool which will diagnose that if a person is suffering from some cardiological problems. Let's begin with the term exercise. So what do you mean by the term exercise? It encompasses any physical activity that increases heart rate and breathing above the resting level. So now you have to know what is the resting level. Resting level means when a person is doing nothing, sitting or sleeping idle. No body muscle is moving. That is the resting state. Whenever a person converts itself from the resting state to the active state, then two vital system of the body comes into play. Number one is heart rate and number two is breathing, because without heart the blood cannot be pumped to different parts of the body either during rest or during exercise, and we need oxygen to the active muscles to do prolonged work. So whenever there is the question of exercise, two things comes into play: the cardiovascular system and the respiratory system. Now exercise fall into two main categories. So number one is aerobic exercise, which is mainly dependent on the oxygen supply. Anaerobic exercise, which is not so much dependent on the oxygen supply. So let's know about the categories. So regarding the aerobic exercise, which is also known as cardio, activities like running, swimming, cycling, and primarily use oxygen for energy production. You can see in the picture that a person is running. When a person is running, that means the whole body muscle is exercising. So each and every body muscle from the tip of the toe to the top of the head, all the muscles, they require the oxygen supply, because without oxygen there will be no metabolism, and without metabolism there will be no production of energy. So aerobic exercise or the cardio exercise, they require huge amount of oxygen. On the other hand, anaerobic exercise, anaerobic, an means no, aerobic means oxygen. So this anaerobic exercise is high intensity activities like weightlifting and sprinting that rely on energy sources that doesn't use oxygen. Very, very important. Doesn't use oxygen. So this is the main difference between the aerobic exercise and anaerobic exercise. Aerobic exercise or the cardio exercise, which includes most of the body muscles during the activity and require only and only oxygen. But the anaerobic exercise, like you can see that here a person is doing the weightlifting. This is such a type of exercise which almost require no oxygen. So there are two types of exercise: aerobic and anaerobic. Now, whenever there is an exercise, there are physiological effects. So, number one physiological effect is on cardiovascular system, number two is on respiratory system, and number three is on muscular system. So, what are the effects? Cardiovascular system, number one. What happens to the cardiovascular system? There is increased cardiac output. What is cardiac output? Cardiac output is that amount of blood which pumped out from the heart in each heartbeat. So the amount of the cardiac output is 5 liter. Number two, elevated heart rate and stroke volume. Stroke volume means in each heartbeat some amount of blood comes out from the heart into the general circulation. That is the stroke volume. An elevated heart rate. Why the heart rate is elevated or increased? Because to meet the oxygen demand to the different parts of the body, the heart should beat not in a regular basis but faster, so that each and every part of the body or the muscle can be supplied with the oxygen. Now there is redistribution of blood flow to the working muscle. That means the part of the body parts which are not working at all at the time will be shunted with the blood to give that extra blood to those working muscles which require more oxygen. Expanded network of capillaries. Normally there are a huge amount of capillaries in every part of our body, but the capillaries are much more in a working condition when the person is under physical exercise. So there are 4 different types of adjustment in the cardiovascular system during exercise. So increased cardiac output, elevated or increased heart rate and stroke volume, redistribution of blood flow to the working muscles and all. Now coming to the respiratory system, number 1, increased breathing rate and depth. Normal breathing rate is 12 to 13 breath per minute. It is increases up to 21 to 25 breaths per minute. Next, enhanced oxygen uptake and carbon dioxide elimination, because each and every working muscle there is the increased demand for oxygen, which is fulfilled by enhanced oxygen uptake. And as because the oxygen is utilized in a high amount, so huge amount of carbon dioxide is also produced in the muscle, which is eliminated. Improved ventilation perfusion matching means more the oxygen is entering into the body, more amount of carbon dioxide is going out. Now, regarding the muscular system, increased blood flow to the working muscle. As I am already told that more the muscle is working, more the demand for the oxygen. Enhanced oxygen extractions, then greater ATP production. ATP we all know, it is the powerhouse adenosine triphosphate. So it is utilized in a higher rate. And improved metabolic efficiency. That means there is a good metabolism inside the body which produces high amount of energy in the form of the ATP. What are the health benefits for the regular exercise? Number 1 health benefits is cardiovascular benefit. It reduces the risk of heart disease by 35% because more you do the regular exercise, heart is also adjusted with that amount of exercise. So you can do your daily work very easily. Lowers the blood pressure and improves the cholesterol profile. Cholesterol actually it deposits into the arteries when they are not utilized or they are not burned. Now strengthens the heart muscle and improve the circulation. So whenever there is an exercise, the heart works much more faster and it becomes more and more healthy. Metabolic benefits: decreases the risk of type 2 diabetes by 40% because the glucose is utilized. Helps maintain the healthy weight. No more deposition of the fat in the various parts of our body. Improves insulin sensitivity, which actually helpful for the reduction of the diabetes. Mental health benefits: it reduces the symptoms of depression and anxiety, means the mental health is good. Improves sleep quality and cognitive function. So more we exercise, more will be our muscles get tired and we will sleep better. Cognitive function, our brain will coordinate more with different body parts. It increases the overall life satisfaction. So if a person is healthy, if the cardiovascular is okay, if the metabolic benefits are there, and if the mental health is also benefited, then a person is happy and healthy. So regarding the introduction to stress testing, it is a diagnostic procedure that evaluates how the heart functions under physical and pharmacological stress. So two things should be kept in mind. Number 1 is physical stress. Number 2 is pharmacological stress. Now, physical exercise stress testing. If a person is walking on a treadmill or cycling, then naturally there will be an increase in the heart rate and evaluate cardiac response to the expiration. Now, what is the pharmacological stress testing? Uses medications like dobutamine or adenosine to stimulate exercise effects when patient cannot physically exercise. Very important. Means from outside you have to input some medicine which will stimulate the person to do the exercise, and then the whether the person's exercise capacity is moderate or higher or lower, that will be detected by the physician. Now, what is the definition of the exercise stress test? An exercise stress test, also known as exercise electrocardiogram, very important. Exercise ECG, there are various names of this test, or treadmill test, or the TMT, treadmill test, is a cardiovascular assessment that monitors the heart's electrical activity while the patient performs controlled physical expression. Controlled physical expression means the patient is not allowed to do whatever the type of exercise he or she wants to do. There is a particular protocol, particular method by which the cardiologist will help the patient to do the exercise, and it will be identified that the person is suffering from any cardiovascular problem or not. The test progressively increases workload to increase the stress on the heart. How the workload is increased? Number one, speed and the inclination of a treadmill or resistance on a stationary bicycle. If a person is allowed to run on a treadmill, either the speed is increased or the inclination of the treadmill is increased. When the inclination of the treadmill will be increased, the thing looks like a person is hiking on a mountain. In case of a bicycle ergometer, there is a load and that is gradually increased to increase the stress on the cardiovascular system of the person. Throughout the procedure, clinicians continuously monitor. This part is very important for you people. What are monitored actually during this TMT test or the exercise stress test? Number one is heart rate and the rhythm via ECG. Number two, blood pressure response. Number three, symptoms reported by the patient. Number four, overall exercise tolerance. So these four are very important, about which we are going to learn in the next few slides. Now, why this exercise stress test will be performed? Number one is diagnostic purpose. You can see it is written. So if we want to diagnose that whether there is any type of cardiovascular problem in the patient, then we have to do this test. So identify the coronary artery disease, means if there is any problem in the coronary artery, if there is some deposition within the coronary artery, whether the coronary artery is functioning well or not. Next, detect the cardiac arrhythmias that occur during exertion, means when the person is running on a treadmill and if there is some uneven type of heartbeat, which is known as arrhythmias, it occurs in the heart, so cardiac arrhythmias, so that should be noted. Next, evaluate the unexplained chest pain or shortness of breath. During exercise, if the person is suffering from any type of chest pain, which might be anginal pain, or if the person is there is some respiratory distress, that can also be monitored during this test. Assess the heart function after the heart attack or surgery. If a person already undergone some heart attack or surgery, then how the heart is now working, that also can be diagnosed by this exercise stress test. So another purpose of this test is the treatment evaluation. And what is that? To determine the effectiveness of cardiac medication. Means after some heart attack or surgery, if the person undergoes some medication, if that medicine is working properly on the heart or not. Next, evaluate outcomes after interventions like stents, bypass, means if there is some blockage of the artery and the person have to undergo some bypass or some stent has been implanted within the blood vessel, and if that particular device working properly or not, that also can be diagnosed from this stress test. Monitor disease progression over time, means if the person is suffering from any type of cardiovascular problem, so if that problem is either increasing with time or decreasing with time after medication. Guide cardiac rehabilitation program. What type of rehabilitation program the person requires after the cardiac medications or something like that, that is also evaluated. And the third important purpose is exercise prescription. Establish a safe exercise intensity level. What is the basic intensity level for the person to perform a safe exercise? Next, determine the target heart rate zone. A person suffering from the cardiac arrest or after rehabilitation with the medicine should not attain the heart rate which is normal for a regular healthy person. So that is also fixed. Then identify the exercise limitation. A patient of cardiac attack should be limited in exercise, that also prescribed by the cardiologist. Then guide the personalized fitness program. But still, if the person after so much of cardiovascular problem want to do some exercise, then what should be the exercise protocol? Safe exercise protocol for that person. So there are three main reasons for this stress test. Number one is for diagnosing something, cardiovascular problems, then the treatment evaluation, then exercise prescription. Now here are different types of exercise stress test. You can see in the picture that a person is doing this test in a bicycle ergometer. This is a bicycle which is fixed, and this is known as bicycle ergometer, as it helps in the testing of the cardiovascular problem if a person is suffering or not by increasing the load. So let's coming in the treadmill protocol. So it is a consisting of 3-minute stages. So there are 4 stages. You can see in the fast stage the speed will be 1.7 mile per hour, a 10% inclination, and the person have to run for 3 minutes. After 3 minutes the speed is increased into up to 2.5, and that is the stage 2, and the inclination will be 12%, and in this stage also the person have to run for 3 minutes. In the third stage the speed will be 3.4 mile per hour at an inclination of 14%, again the 3 minutes of workload. At the last stage and the fourth stage the speed will be 4.2 mile per hour, elevation will be 16%, and the person have to run for 3 minutes. So it is called the modified Bruce protocol. So you have to keep it in mind. It is the modified Bruce protocol, which is very famous regarding this purpose. Now, regarding the bicycle protocol, a low workload of 25 to 50 watts it is started with, and increased by 25 to 50 watts every 2 to 3 minutes. What is the advantage of this bicycle ergometer test rather than when compared with the treadmill protocol? A better ECG quality with the less motion artifact. Means when a person is running on a treadmill, there is every possibility of losing the ECG leads. But this is not true in case of the bicycle ergometer, because the person is sitting on the ergometer and doing the test. Next, easier blood pressure monitoring. When a person is running, it is difficult to measure the blood pressure. But in case of the bicycle ergometer test, as you can see, the person is sitting on the bicycle, and if a cuff is tied over here, then easily you can take the blood pressure measurement. Next, less less intimidating for elderly or deconditioned patient, then low risk of the fall. So these are the benefits of bicycle ergometer test rather than treadmill protocol. But as you can see that in bicycle ergometer test, less amount of muscle mass is involved, as the person is sitting on a seat of the bicycle. But this is not true in case of the treadmill, but the whole body muscle is working. Now, how the test is performed. So there are 4 stages for the test. Number 1 is preparation of the patient, next electrode placement on the patient, next exercise phase, and the last one is recovery phase. Now, regarding the preparation, patient changes into comfortable clothing. That clothing should be not tight. Then medical history and the medications should be reviewed, that if the patient is suffering from any previous cardiovascular problem. Then baseline vital signs are recorded like blood pressure, heart rate, breathing rate, etc. Then resting ECG is obtained, whether there is any problem already in the ECG. Step 2 is electrode placement. 10 to 12 electrodes are attached on the chest and limbs. Skin may be shaped or cleaned for the better contact. Then leads connected to the ECG monitor so that the smooth ECG recording can be done. Third phase is exercise phase. Patient began walking or cycling at low intensity. Then workload increases in the stages every 2 to 3 minutes as we have just discussed. Then continuous ECG, BP and symptoms monitoring. This is very important part. This one, continuous ECG, BP and symptom monitoring, because this will tell that whether a person is actually suffering from any cardiovascular problem or not. Next, during the recovery phase, intensity gradually reduced, means the intensity means the speed of the treadmill and the inclination of the treadmill. Monitoring continuous for 5 to 10 minutes that whether the heart rate is returning to the pre-exercise level or not. Recovery ECG patterns are important diagnostic indicators that whether the ECG pattern which was before the test is again attained after the test also. Key measurement to be done during the test. As we have discussed now, ECG monitoring, ST segment changes, whether depressed or elevation. T-wave monitoring is very important. If there is any arrhythmia, then heart rate response and recovery. Whether the heart rate is under tachycardia, means increase of the heart rate, or bradycardia, decrease of the heart rate. And recovery means whether the heart rate is returning back to the normal level after exercise within 5 to 10 minutes. Next phase is blood pressure response. Normal systolic BP increases, diastolic stable. But if it not happens that the systolic BP decreases, then that is an indication for the heart problem. Abnormal hypotensive response or aggregation rise measured every 1 to 3 minutes during the test. So these are the protocols you have to keep in mind. Next, exercise capacity and symptoms, whether the given exercise workload can be fulfilled by the person or not. So metabolic equivalent have to be measured, then duration of the exercise, then rating the perceived exertion by the box scale, whether the person can continue the test or not, if there is any chest pain, dyspnea, fatigue, etc. What are the indications for the stress testing? Suspected CAD, if there is any CAD, which will be indicated by abnormal ECG, multiple cardiovascular risk factors, then known CAD, if there is any post myocardial infarction assessment, etc. Then arrhythmia assessment, if the heart rate is increasing or decreasing or stable. Exercise prescription, then cardiac rehabilitation guidance, then safe activity level assessment, etc. What are contraindications and precautions? Absolute contraindications are acute myocardial infarction within 2 days actually, unstable angina not previously stabilized. These are all those symptoms which can indicate that the person is suffering from the cardiovascular disease. So there are some relative contraindications which also have to be keep in mind. Preparation for the test. Before the test day, there should be some stoppage of the medication, beta blockers, calcium channel blockers, nitrates, etc., which may hinder the test. Then at the day of the test, light meal should be taken, caffeine and tobacco should be avoided, comfortable clothing should be worn, etc. List of medications should be with the patient so that in case of emergency this can be applied. Now, what to bring? For the official purpose, insurance card, current medication, previous cardiac test results, water and a small snack, etc. Test endpoints and when to stop. Normal test endpoints. Achievement of the target heart rate, that is 85 to 100% of the age predicted maximum, means when a person attains the maximum heart rate, then the exercise should be stopped, otherwise it may cause the heart attack. So there are other also points that should keep in mind. Absolute indication to stop, when the person should be stopped of doing the exercise, when the ST is elevated, drop of systolic blood pressure, moderate to severe anginal pain, Central nervous system symptoms like dizziness, ataxia, signs of poor perfusion like cyanosis, pallor, sustained ventricular tachycardia if the heart rate gradually increases, technical difficulties with monitoring. So these are the absolute indications which indicates the person to stop the stress test. How the results will be interpreted. Normal findings, what if a person is normal, what will be the findings? Appropriate heart rate will increase during the exercise, there will be normal BP, no significant ST segment changes, no arrhythmia, good exercise tolerance, etc. But what are the abnormal findings? That is very, very important. Abnormal findings are very, very important for you people. This is, we can give a star mark over here. If the ST segment is depressed, if the ST segment is elevated, both are not good. Abnormal BP response, then exercise induced arrhythmia, then poor exercise capacity, if the person is no more able to do the exercise and all. So what are the risk and the safety profile? So risk of myocardial infarction is 0.01%. Then risk for serious arrhythmia 0.04%, etc. So these are the safety measures which should be taken during the TMT. What are the other tests that can be done during this stress test? So number one is nuclear stress test, where it is a combination of exercise with radio tracer, where the tracer will be perfused into the body. It is mainly due to visualize the myocardial perfusion. Next is stress echocardiography. Uses ultrasound to visualize the heart wall motion. So this is for the myocardial perfusion, this is for the heart wall motion, and the MRI trace testing. Newest advancement using MRI completable treadmill for the pharmacological stress. So these three should be kept in mind. This nuclear stress test is for myocardial perfusion. This stress echocardiography is for the visualize the heart wall motion before and after exercise. MRI stress testing for the pharmacological stress. What is the summary and the future directions? Exercise both essential for health and a valuable diagnostic tool. It should be followed. It's pocket friendly. Exercise stress testing remains a cornerstone of the cardiac assessment. Those advancements are very much costly, so this is less costly. The test evaluates heart function under controlled physical exertion, also in the presence of cardiologist and doctor. Multiple protocols consist of accommodate different patient populations, were combined with imaging, diagnostic and accuracy significantly improved. So this is very much important. So do like, share and subscribe my channel to get the notification of newly advanced videos on different topics of hematology, cardiovascular system, cardiac care, dialysis and all. Thank you for watching. Keep in touch with me so that you can get the notifications of newly uploaded videos. Thank you.